Good morning. You're listening to AM Ocala Live, WOCA The Source, 96.3 FM, 1370 AM. Happy Thursday, everybody. As we're rounding out our show here now after the bottom of the 10 o'clock hour, as we're coming up 20 minutes before the top of the 11 o'clock hour, as Thursdays, as everybody is maybe unaware, as we're trying to do this more often as a segment as such every Thursday in the studio, County Chairman Commissioner Kathy Bryant, welcome. Glad to have you back.
Good morning. I'm glad to be here, and good morning, Marion County.
Yep. As we've got you in here, we've talked a lot through the week. We were talking this a little bit off air, just about all of the news, the media, the expectations of what we've been hearing, coronavirus. But with that being said, what's necessary is good information that's worth hearing, that is true, factual, and that's what we brought for today, is to talk a little bit and discuss the coronavirus, the expectations within our county of it, and how it has now come to Florida in itself, but then some other things overall. So welcome, and let's get started. So where do we start? There's so many places to start, so to speak.
Yeah, there is a lot, and I have a lot of information here that I think that our listeners will find helpful today. And I think the first and foremost is everyone needs to remain calm and get good information.
Yeah.
We need to make sure that we're not listening to rumors and that we really understand what COVID-19 is, and what precautions are being taken, and what the facts are regarding COVID-19.
So that's a good place to start. What exactly is this? What do we know? What's the good information we found out exactly what this is?
So, the street name, for lack of a better way of saying it, is the coronavirus. So there have been variations of the coronavirus around for years. The strain that we're seeing now, COVID-19, is a new strain, and it's different than the other strains that we've seen in previous years. So if you're out there and you hear, oh, somebody has the coronavirus, don't panic, first of all, because chances are it is not COVID-19. We dealt with a rumor this week that was going around that talked about someone in Dunellen having the coronavirus.
Yeah.
Yes, someone in Dunellen did have the coronavirus. However, it was not COVID-19. It is the old coronavirus that's been around for years, the one that they talk about on the back of the Lysol cans,
right,
and the Sani wipes and those types of things. It's important for everyone to know, as of today, there are no confirmed cases of COVID-19 in Marion County. And do we have a handful that have been sent off for testing by the Department of Health? Yes, we do, but nothing has come back as positive for COVID-19. And another thing that I think is important for everyone to understand is we get those results back very quickly. 24 hours. Within 24 hours of the Department of Health sending off the samples, they have results back as to whether or not someone has COVID-19.
Interesting. And that's what people don't know. It's like, oh, yeah, but how long does it take to get results? Hey, one day. 24 hours.
24 hours. I think the other thing is as of last night, because that's our latest information, there are 3 confirmed cases in the state of Florida. The first case came in from, it was a transferred, they term it as transferred in from outside the United States. So the case in Hillsborough County, one of the 2 cases in Hillsborough County, was a female who was in Italy, was sick in Italy, and came back with COVID-19, then I believe transferred it to a spouse or someone within her household.
Yeah, I think it was a sister or something, a family member, if you will.
And then we have one other case in Manatee County where they are tracing back to find out what the origin of that was. In the U.S., there have been 80 confirmed cases. Important to remember, 13 states have had at least one confirmed case, with the hardest hit areas being California and Washington State. 40 of those and then we have 40 being evaluated. Out of those 80 cases, 24 were transferred in from outside the U.S., meaning people who have traveled to other areas and came home sick. 16 were locally acquired. And then we have 40 being evaluated as to where they came from. I think that's really some of the important things to realize. And also, I know that there was a big splash on the news yesterday of 11 deaths in the U.S. I think one of those was from California, and the majority of those cases came from a nursing home in Washington State.
And that's a tidbit I wanted to touch on a little bit. As we were talking about the virus throughout the last month and a half, the expectations of why it's a concern, of course, is whether or not you contract the virus, even age. And I think a lot of times some of the media was missing what the age was for certain people, and with the so-called death toll that we're talking about with Washington so hardly impact, well, there you go. We're talking about a retirement or a nursing home itself that we can assume, older ages, and that's why it was hit like it was. It's different because I heard through the weekend that a lot of people died. It wasn't just every random person within the downtown metropolis of Seattle. It wasn't like that. It's something different in itself, and that's the type of information that needs to be reported.
Absolutely, and the thing to remember is those most at risk are the elderly and immunocompromised. Most people who contract COVID-19 will show mild to no symptoms, which is why in some instances it might be harder for them to track down where the contact came in from, because you could have somebody who traveled outside of the United States who contracted the virus, who came back, actually showed no symptoms, and someone else got it. So that's the important thing to remember. I think another thing that we probably want to touch on is the efforts here within Marion County.
Absolutely.
And what's happening. So first of all, I want everyone to know that all of our partners are working together. All of our governmental agencies are working together. Department of Health, Marion County Emergency Management, and Marion County, we are all working together to make sure that we have plans in place, and there are already plans in place as we continue to make sure we stop the spread should we have any cases in Marion County. And not only do we have plans in place, but we continue to monitor those plans and tweak those plans on a daily basis to make sure that we're taking the steps necessary to contain the COVID-19 and to stop the spread of COVID-19. And those, governmental agencies, again, are working together. I think another very, very important thing that is an absolute for everyone to remember, and this goes back to your elementary school days.
Yes.
Hand washing.
Yes.
It is key in the element of prevention. Wash your hands frequently with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. And if soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Another thing that we're taught, and we kind of got away from as a society, I think, but avoiding close contact with people who are sick.
Yeah.
And the big one, we went from stay home when you're sick to, power through it.
Yeah.
Go out there, go to work.
Yeah.
Make sure you're keeping up and doing your stuff when you're sick. No.
Yeah.
If you are sick, stay home.
Yeah, and that's something that I think you're right. And I touched on this not that long ago. I think I was mentioning it to Joe. It is a little tougher in some instances for people to do that, because I can tell you this, a lot of people, minimum wage jobs to mid-level jobs, don't offer sick days. Right. I work a slew of jobs myself that don't offer that. If I don't work that day, I don't make the income. But see, that's where it's got to be on the basis of being able to think smart outside of yourself a little bit and understand that, okay, well, if you're under the weather and in a situation where we're talking about the seriousness of where we're at with something like COVID-19, that it's take the priority in making yourself feel better. Like it's, it's an opportunity to think to yourself, what would be the smart thing to do here? It'd be to stay home and rest and get yourself back to 100% before you go out there and just assume, well, I got to do what I got to do. Well, that's a little selfish in sense, because you're not the only one out there for everything, So it's a matter of thinking, okay, let me get myself 100%, especially now with everything that's going on. Stay home, take care of yourself, and then get better.
Right. And I think some other things that, we'll touch on today is another thing for people to understand. What are the symptoms and signs? Mm-hmm. As we stated earlier, the most at risk are the elderly and the immunocompromised. Most people will have mild to no symptoms. But for people who do show symptoms, those patients with confirmed infection have reportedly had, like we said, mild to severe respiratory illness with symptoms of fever, cough, and difficulty breathing.
Mm-hmm. Which is tricky, because we know there's some people going, those aren't very serious. Mm-mm. And they're subtle, yes. And that's why one of those things about this COVID-19 is so tough right now, is because of the symptoms and signs being so light, in a sense that it's something like that most people are like, it's nothing. I'm just dealing with maybe just a little cold that I have, and like you said, power through. Well, in essence, if you start to notice these, now it's appropriate to maybe consult a physician and just see if it's just something is not feeling good and under the weather that way, or if it could be something more, because these symptoms are so subtle. Correct. The signs are so subtle.
Correct. I think another very important thing, what should I do if I think or someone in my family might have COVID-19? First and foremost, contact your county health department.
Okay.
They are going to tell you what you need to do. They're probably going to have you come in, and they're going to tell you what you will do when you come in as far as testing is concerned. Or consult a healthcare provider as soon as possible. Very important here, call ahead and tell them before you visit that you think you may have COVID-19, so they can take precautions to prevent exposure to other people. Mm-hmm. Mm-hmm. Cover your mouth and nose with a tissue when coughing or sneezing. If you have a surgical mask, and it has to be the N95 mask, not just a surgical mask, wear it during close contact with other people. A mask can reduce the number of droplets coughed into the air, and that's actually where your spread comes from, are the droplets that go into the air when you cough and sneeze. Mm-hmm. Really remember this one. Very few respiratory infections will be COVID-19. Review your signs, symptoms, and travel history thoroughly with your physician. 24/7 consultation is available to physicians through contacting their county health department or the Bureau of Epidemiology. If I'm exposed to COVID-19, here's another question that we get asked a lot. How long will it take for me to become sick? Mm-hmm. The time for exposure the time for sickness between being exposed and generally when people become sick for COVID-19, that's called the incubation period. And the incubation period for COVID-19 is typically 2 to 14 days. Now, that's not, an absolute.
Right.
In some cases, it could be a little longer. Not it will be, but it could be.
Right.
But for the average, it's 2 to 14 days. We have people that are asking, is it safe to travel to China or other countries where COVID-19 cases have occurred? The United States State Department, let me make sure I say that right, has issued a level 4 do not travel advisory to China, which means they recommend that all travel to China is canceled. The situation is evolving on a daily basis, and I'm sure you'll hear more if there are any advisories to any other countries. This is going to change, more than likely daily or every other day as we get more information. We're going to make sure that that information gets out to the public, first and foremost, so that the public has accurate information, not some of the sensationalized information that you might see on social media.
Right.
Or
the best way you put it too, sensationalized, because that's what we were talking about earlier, just how it affects you truthfully, emotionally, and what you need to do to say, oh, I heard this and I'm just going to do this, but is that true? Is that factual? Where did it come from?
Right. I think another thing, and I hope your listeners, if listeners out there, if you have a pen and a paper available, I want you to get that. And I'm going to talk about something else for a minute to give you an opportunity to get that, because I'm going to give you a very important number in just a moment. Again, remember, the medical community has been receiving information on an ongoing basis since early January through blast fax and emails from the Centers of Disease Control and the Department of Health. Our Department of Health in Marion County has had an established incident management team since January who participate in weekly state calls and work on local actions. There was a medical provider meeting held at our Emergency Operations Center on February the 20th, 2020. That was the day that I came in a little late to the studio.
That's right.
Because I was there for that, to give updates and discuss procedures for monitoring and transferring a person under suspicion. Emergency Management, Department of Health, the Marion County School Board, Marion County Emergency Management have all met to review operational procedures in the event we are to have increased cases in Marion County.
Okay.
Department of Health has met with the College of Central Florida and met and reviewed guidance on how to address students who return to college and have a travel history to the 5 travel-impacted regions. We've been in contact with Marion County Senior Services to make sure there's no unmet needs there. There will be a presentation from Mark Lander, the administrator for the Florida Department of Health in Marion County, at the Marion County Board of County Commissioners meeting this Tuesday at 9 a.m. That is held in the Commission Auditorium at 601 Southeast 25th Avenue, Ocala. If you cannot make it and you would like to watch the presentation, you can go online, www.marioncountyfl.org, and watch that presentation for the latest up and most current information. And last but not least, if you have any questions regarding COVID-19, please don't go to social media.
Right.
Please pick up the phone and call the call center at 866-779-6121. That's 866-779-6121. After our presentation on Tuesday from Mark with the Department of Health in Marion County, I'll probably come back with some updated information for you next week.
Okay.
For our time that we'll have together.
Yeah.
And I just, stay calm, get reliable, factual information. Don't get caught up in the sensationalism of this thing. And be assured that all of your partners in Marion County are working diligently to make sure we keep our community safe.
Absolutely. Absolutely. A lot of good stuff there, because this is where we should hear it from, is the good factual information that comes through about what's being done within our community for this. And that's excellent. Thank you, Kathy, very much. As we round ourselves out to the top of the 11 o'clock hour, on a different note, is there anything else you just want to tie in and plug just to finish out the last couple minutes as we've gotten the heavy stuff, so to speak, out of the way?
Goodness, now he's asking me to switch gears here.
to lighten it up, to kind of give the negative then with a positive, so to speak.
We I'll do this. I'm going to plug the Strawberry Festival, Habitat for Humanity Strawberry Festival, which will be at the McPherson Complex this Saturday. I'll be there to give some opening remarks Saturday morning. And if you want to have a fun, family-filled day, please come down, support an amazing group of people for a very important cause, Habitat for Humanity.
Yep.
You know, they're helping put roofs over the heads of people who possibly might not ever have that opportunity. And the great thing about Habitat for Humanity is every person that has a Habitat for Humanity home, they're putting their sweat equity into that home. And this is a great day to come and help the organization that helps those people, and to grab some strawberries, some strawberry shortcake. They've got a great line of events lined up for the day, and hope to see everybody out there.
Yeah, excellent. Yep, the Strawberry Festival, the pie eating contest, car show outside the McPherson Complex, 9 a.m. to 5 p.m. There we go. We got to find the positive, the silver lining stuff. And it's outside, too, and the weather's going to be phenomenal. It's going to be a little chilly, which is just a jacket or two, but it's going to be sunshine, and we need that sunshine right now just to make us feel good, as we got sunshine right now with some dark clouds moving in. But that's okay. We know that the cold front's coming through to give us some good weather for the weekend. And with that, as we sign out our show here, AM Ocala Live, thank you, everybody who was listening today, Thursday, March 5th. It was a good show, informative, and stay tuned for tomorrow as we round out the week. Our first full week in the books for March will end tomorrow. So, Kathy, thank you very much. And to everybody out there, as I always say, until tomorrow, goodbye.
This is a Fox News alert. I'm Lillian Wu. Fox News confirms that Senator Elizabeth Warren of Massachusetts is dropping out of the race for the White House.